Contraception is a common discussion point during gynecological consultations. It's invariably an important question whether you come to see me for advice on contraception or whether you come to see me for any of other gynecological concerns. The reason for this is that contraception has a huge impact on our well-being, and briefly speaking, we could divide contraception into two groups: barrier contraception and non-barrier contraception. Now, it's important to remember that contraception has two important roles to consider. One is the obvious one, which is the prevention of pregnancy, but the other one is prevention of sexually transmitted diseases. And it's in that context that we need to remember that barrier contraception, such as condom, might be necessary alongside any other form of contraception that you choose to use. So if we talk about non-barrier contraception, then broadly speaking, you could divide them into pills, injections, implants, and IUDs, or a contraceptive coil. You may need to sometimes speak to a specialist who specializes in contraceptive, or a gynecologist who has in-depth knowledge of various contraceptive options to decide which one is the best one for you. Especially in gynecology, a lot of these medications are used for other gynecological conditions. And lastly, there is permanent contraception, which is in the form of what's commonly referred to as sterilization. Permanent contraception or permanent sterilization usually involves a keyhole surgery where a clip is applied to each of the fallopian tubes. Recently, there has been a change in how we perform this surgery, where rather than putting clips on fallopian tubes, there is an increasing trend towards removing the fallopian tubes. The reason for this shift is a couple of things. So one is that if fallopian tubes are removed, there is a reduced risk of cancer of the ovaries in future. And second, sometimes clips on fallopian tube have caused some pelvic pain problems for certain patients. It's important to remember that removing the fallopian tube means that there is no chance of reversal of that sterilization procedure. So if ever there is any future regret or any future change in views about wanting a baby, then if the tubes are removed, there's no way of putting those tubes back. Contraception, like all medication, will have some side effects, and these depend from patient to patient. So it's not uncommon to have some irregular bleeding, certainly within first few months of starting a new pill or an injection or an implant or even an IUCD such as a Mirena coil. Some people will notice that they get more acne, more oily skin, and some people may notice that there is a change in their mood. For most patients, these side effects are short-lived and will recover in time, but it is quite possible that if these symptoms persist, then perhaps the contraceptive you're on is not the right contraceptive for you, and you may need a change in the type of contraception you're on.